Malacanang says President Duterte has declared a state of public health emergency following more COVID-19 cases being reported over the weekend. JC Cosico with the rest of the story.
The Health Department has raised Code Red Sublevel 1 alert over the coronavirus disease or COVID-19. This means concerned government agencies must expand their response to curb the spread of the infection.
This is a preemptive call to ensure that national and local governments and public and private healthcare providers can prepare for possible increase in suspected and confirmed cases.
The DOH has also asked Malacanang to declare a state of public health emergency.
The DOH has recommended to the Office of the President for the declaration of a state of public health emergency, which will facilitate mobilization of resources, ease processes, including procurement of critical logistics and supplies, and intensifying reporting.
The move came after the country's first local transmission of the SARS-like virus was confirmed on Saturday. A day later, the DOH reported 4 more cases, bringing the total number of confirmed infections to 10. One of them is a 38-year-old Taiwanese male who has no history of travel outside the country, but came in contact with an infected Taiwanese foreign national who visited the Philippines. The 8th case is a 32-year-old Filipino male who reportedly traveled to Japan within the past 14 days. An 86-year-old American male is also among the new cases. He has pre-existing hypertension and history of travel to the U.S. and South Korea. The 10th case, meanwhile, is a 57-year-old Filipino male with no history of travel outside of the country. Public establishments such as malls are now ramping up efforts to mitigate the outbreak. Temperature checks are now becoming a norm.
Para ma-rule out din kung may fever nga yung papasok doon. At least somehow matatanggal yung mga may fever, hindi makakahawa.
Some bus terminals are also providing alcohol and hand sanitizers to passengers.
Para protection na rin, kailangan mag-ingat na lang tayo. Lahat maging malinis sa katawan.
The Health Department is now asking Malacanang to declare a public health emergency after the country's confirmed cases doubled over the weekend. The palace says President Rodrigo Duterte is set to sign an executive order today to declare a public health emergency. For News 5, JC Cosico, We Are One News.
Presidential spokesman Salvador Panelo broke the news about the declaration in a radio interview earlier, but the formal document has yet to be released. The state of emergency will allow government to cap prices of basic goods and scrap public bidding for medical supplies. Meanwhile, about half of the world's countries now have confirmed cases of the virus. As of 9 a.m. today, total COVID cases worldwide surged to over 109,000. That's according to data collated by Johns Hopkins University. The figure includes more than 80,000 cases in mainland China. The death count outside of China is now nearing 700, bringing total deaths around the world to over 3,800. Italy has the second biggest outbreak of the virus in the world with over 7,300 cases. Italian fatalities have already outnumbered that of South Korea's death count. The Italian government is now imposing a lockdown in its northern region, restricting the movement of nearly 16 million people. The sweeping move is for the entire Lombardy region, where Milan and Venice are located. The lockdown runs until April 3rd. It sees the closure of schools and universities and the cancellation of all public, sports, civil, and religious events and ceremonies. Now, over in Brussels, the European Union is warning of a rapid increase in COVID-19 cases and its impact to the EU economy.
It will affect, if not all, many of the sectors, from that of the economy to tourism, to migration, to transport. The spread of COVID-19 is a test of, I would say, of the resilience of our health systems. We need to ensure that there are sufficient financial and human resources made available.